to record. My apologies. Great. So throughout this session, I hope we can take away these concepts. We're going to talk about heart health as an analogy, heart failure. We're going to relate it back to the heart as a home analogy. We'll discuss coronary artery disease, arrhythmias, signs of emergency, and tips to implement for optimal cardiac health. So when I say the house as a home analogy, I'm talking about, think of your heart as a home. The heart is a complex muscular organ that pumps blood filled with oxygen and nutrients throughout the body. But I want you to think of the heart as a two-story house with 4 rooms or chambers separated by strong walls. Okay, so this simple analogy helps explain its structure and the special care it needs. And it may help you in understanding your heart. So if we were thinking about our heart as a 2-story home, there would be 2 atria upstairs and 2 ventricles downstairs. Blood is pumped through these chambers, aided by 4 heart valves that act like doorways. Diseases of the heart can be traced back to problems with their plumbing, the electrical, or structural systems. So we'll start by talking about the structure of the heart. So your heart is structured to collect and direct blood. The rooms of your heart, called chambers, are where the blood collects before moving with each heartbeat. Okay, so these abnormalities in heart function can cause fluid to back up in your lungs and other part of your body, like your ankles. The congestion in your heart and the lack of oxygen may make you feel tired and short of breath. This is called heart failure. So again, going back to our house analogy, heart failure is an issue in the structure of the heart. Okay, so it is a condition that develops after the heart becomes damaged or weakened. Heart failure is when the pumping action of your heart is not strong enough to move blood around. And that's especially during increased activity or when you're under stress. The heart muscle may not relax properly to accommodate the flow of blood back from the lungs to the heart, causing congestion. So sometimes the fluid in your lungs can accumulate and it can cause a life-threatening condition called pulmonary edema. And this is an emergency. This is an emergency when this happens. So heart failure does have many risk factors. The most common is damage to the heart muscle caused by a heart attack, which we'll address a little bit later in this presentation. So what should I look out for when I think about heart disease? First, we're going to start off with heart failure. So if you notice that you're getting increased shortness of breath, especially when laying flat, or you have a sudden gain of more than 1.5 kilograms, which is 3 pounds, over 2 to 3 days, or 5 pounds in a single week, and you can't trace it back to just COVID weight, just kidding. No, but seriously, if you do have this increase in weight gain that you can't explain, bloating or feeling full all the time, a cough or cold syndrome that lasts longer than a week, or all of a sudden you're feeling really tired. If you have a change in your appetite, or you find that you have increased swelling in your ankles, your feet, your abdomen, and you're frequently waking during the night, these are good reasons to talk to your family doctor. It's important to differentiate if something's an emergency or if it can wait till the next appointment with your family doctor. I want you to go to the emergency room here at Markham Stouffville, or call 911 if you have any of the following. If you're struggling to breathe, if your shortness of breath does not go away while sitting still, if you have a fast heartbeat that doesn't slow down when you rest, if you have chest pain that doesn't go away without rest or medication, like nitroglycerin, if that's something you're ordered, or if you have trouble thinking and you're feeling confused, also if you have fainted. These are all good reasons to go to your nearest emergency department. These are recommendations offered by the Heart and Stroke. You'll notice throughout this presentation, I refer back to the Heart and Stroke often, as they are a great resource and they provide up-to-date information on how to care for your heart. The Heart and Stroke uses a color coding system. These symptoms would mean that you're in the red danger zone and that you would need help immediately. So next, we're going to move on to the plumbing of your heart. So going back to the house analogy, the plumbing, as we refer to as the coronary arteries. The heart is the home base for the entire network of blood vessels that bring blood to and from the heart. Just like a pipe might be blocked or clogged and might need cleaning, so may a coronary artery. So if you look at this picture here, it gives a great depiction of what our coronary arteries look like. As you can see on the slide, this is the vasculature that feeds the heart. Okay, so your heart needs its own constant supply of oxygen to keep pumping. Coronary arteries carry blood rich in oxygen to the heart. Normally, blood flows through the blood vessels like water through a hose. In coronary artery disease, the coronary arteries become narrowed or blocked. This reduces blood flow to the heart. This is often called hardening of the arteries or atherosclerosis. Atherosclerosis usually occurs early in life. Many people have plaque by their middle age. Over time, the artery narrows or gets blocked. This stopping blood from flowing through the artery can cause symptoms. A plaque may form. As you see on this picture here, a normal artery, going back to the plumbing, just allows blood to circulate freely. When there's a plaque, there will be a reduced amount of blood flowing through that area of the artery. Okay, a plaque can also break open. If this happens, a blood clot, which is also called a thrombus, can form and breaks and blocks off the blood flow. Mild plaque doesn't usually affect blood flow very much, but if you had a severe blockage, you may become symptomatic. So again, atherosclerosis is the buildup of plaque on the inside of the wall of an artery. It's a sticky mixture of fatty streaks that build up, making the walls of the artery thick and hard. And the coronary arteries and the arteries in the neck and the legs are the most often affected. So atherosclerosis does not usually have any symptoms until the artery is at least blocked by 50%. Severe blockages do cause symptoms in most people. The first symptom can often be chest pain. And for most people, this is the first time they figure out that they have any form of atherosclerosis. So what causes these arteries to block? Well, sometimes it can be because of high blood pressure. So blood pressure measures the pressure of blood on the walls of your arteries. High blood pressure, also known as hypertension, is when your heart muscle has to work a lot harder than normal to pump blood through your arteries. This can weaken your artery walls over time, and it can increase your risk for heart disease. Your blood pressure target depends on your age and if you have diabetes. Another thing that can cause your arteries to block is high levels of cholesterol and triglycerides. So I'm not sure if you've heard of LDL cholesterol, but it's called bad cholesterol. It can increase plaque buildup, which can lead to atherosclerosis. High levels of LDL cholesterol increase your risk of heart attack. HDL cholesterol is called a good cholesterol because it helps move bad cholesterol to the liver for breakdown. Low levels of HDL cholesterol increase your risk of heart attack. High levels are actually good. Triglycerides are a type of fat. They're not a type of cholesterol. Your body switches some calories from food to triglycerides. Cholesterol is important. It's found in all cells of the body. Your body makes most of the cholesterol in your blood. Only 1/5 actually comes from food. Another thing that puts you at high risk for your arteries to block is having diabetes. So as you may know, diabetes is a condition when the body does not make enough insulin or does not use the insulin stores well. It breaks down sugar in your blood into energy for your body. But if your body doesn't make enough insulin or cannot use it properly, then you'll be left with high blood sugar. High blood sugar can actually increase the plaque buildup and cause narrowing of the arteries. Having an apple-shaped body actually puts you at higher risk, and this is related to waist circumference. We're going to include a couple links at the end of this presentation. If you're interested in learning more, we're going to provide the link for the Heart and Stroke Foundation. They offer a great resource and can talk about different things and strategies you can do to prevent your risk. Smoking tobacco is the most common and preventative cause of death in Canada. Smoking causes almost half of all deaths from heart disease among Canadians. So damage to your arteries from smoking leads to a buildup in plaque as well. There are some things we just can't control, and that is if heart disease runs in your family. So knowing your family history is really important. I spoke about this a little earlier, but I want to bring it back to angina. So angina, which is chest pain, is caused by a drop in blood flow to the heart. This means that the heart muscle does not get enough oxygen to work well. Angina is a serious warning signal. It can happen before or after a heart attack or by itself. And over time, many angina attacks can weaken the heart muscle so that it doesn't pump well. This means that your body does not get the oxygen it needs to carry out normal activities. So as I've shown in this slide here, here's what angina looks like. It can feel like tightness, pressure, or discomfort in the chest. I've had patients explain to me that it feels like an elephant is sitting on their chest. It's an ache or discomfort in areas other than the chest, neck, jaw, and throat, arms, or back. And it can present differently in female and male people. What I notice is that a lot of females present with jaw pain and nausea. And that's consistent with the feedback from the Heart and Stroke as well. So we want to make sure that we're not just throwing away these aches and pains as not important, because they are. And if you're consistently having pain like this, you do need to bring it up to your family physician. Okay. It can also look like things like indigestion or heartburn and pain that doesn't go away with rest. You can feel short of breath. You can feel fatigued all the time. And you can have a hard time getting through your daily normal activities. There's a big difference between stable and unstable angina. So let's say every time you went for a run, you noticed you had chest pain. That would be considered stable angina. It's predictable. With rest, the angina goes away. But if you're resting and that's when you get chest pain, that's concerning. If you feel like you're having chest pain, even in your sleep, this is something you really need to speak to your physician about. So now we're going to put some of this information together. And again, bringing it back to the house analogy. Right now, we're thinking about the plumbing. So what is a heart attack then? A heart attack happens when the blood flow through one or more of the coronary arteries is blocked. So this buildup in plaque can make it so that blood circulation can't get through. Okay, the blockage stops oxygen from reaching these parts of the heart. The damage happens because not enough oxygen is getting to the muscle. So as we showed that picture before, where we talked about the anatomy of the heart, the arteries of the heart are the heart's unique blood supply. And if these plaque formations are causing difficulty for blood to get to the heart, that area of the heart is no longer functioning. And it can lead, if ignored, to long-term damage. Sometimes coronary arteries go into spasm. So they squeeze or contract strongly, and then they relax. This can stop the flow of blood through the artery and can cause a heart attack as well. And often the causes of spasms are unknown. So let's bring it all together. What is the difference between an angina and a heart attack? Well, we talked about unstable and stable angina. So this slide shows us the difference. So as we talked about, basically the chest pain can occur even at rest, and it can cause damage to the heart. What does it feel like? Again, we talked about this in a previous slide, but it's really important to know what these symptoms are and know what to look out for. In a heart attack, people often feel so severely nauseous. Their skin feels sweaty, and they have a really hard time participating in their daily activities. Angina, on the other hand, comes and goes, relieves with rest, and doesn't go on for more than 15 minutes generally. But a heart attack does, and it's consistent. It stays there no matter what you do. So what relieves this pain? Well, if you have a cardiac history and you've seen a cardiologist, or your family doctor has given you nitroglycerin, you may be familiar with this. And we'll talk about it a little bit more in another slide. But if you are having stable angina, using nitroglycerin will work. But if you're having a severe heart attack where the muscle in your heart is being impaired, nitroglycerin and rest will not help. So what's happening to the heart at this point? Well, it could cause a scar on the heart muscle. And if you wait too long, it can become permanent and can permanently affect your heart. We often say time is muscle in the cardiology world. Time is muscle means you need help right away to make sure that we can preserve and save that area of your heart that's not getting enough blood supply. The affected area of the heart needs blood supply. So again, let's take this home with the most common signs of a heart attack. This slide is offered by Heart and Stroke. So these infographics are just trying to illustrate the symptoms we talked about in the previous slide. That might look like chest discomfort, discomfort in the neck, jaw, shoulders, arms, and back, shortness of breath, sweating, nausea, and lightheadedness. So if you're having symptoms like this, you may be having a heart attack. It's really important that you stop what you're doing and you lay down. It's important to listen to your body. If you do have a nitroglycerin prescription, what that does is acts as a vasodilator. So it's a type of medication that's a spray. It goes under your tongue. It is not available over the counter. It does need to be ordered by your physician. If you do have a prescription for this, you take one spray under your tongue and you wait 5 minutes. At this point, you're waiting to see if that spray was effective. If you still have pain, you can take another spray, but you need to start thinking about calling 911. When you call 911, you need to advise the operator of what symptoms you're having. After the call to 911 has been made, you can take a third and final dose. If you do not have a prescription for nitroglycerin, please call 911 right away. Do not drive to the hospital or allow a family member to drive you. The operator may advise you to chew and swallow 1 adult tablet or 2 80-milligram tablets of ASA, also known as aspirin, as long as you're not allergic. Please do not take any other medications such as Tylenol or acetaminophen or Advil, also known as ibuprofen, instead of aspirin. Do not substitute aspirin for medical care. Please call 911 if you're having these symptoms. Rest and wait for the emergency medical team to arrive. The reason we talk about aspirin is it's an antiplatelet. So this medication can help restore blood flow to the heart. So now that we've talked about plumbing, it's important that we address the electrical system. So the electrical system, just like a house, the heart has electrical functionality thanks to its sinoatrial node. Essentially, it's the heart's natural pacemaker. It helps regulate the heart rate. Electrical pulses trigger heartbeats. These are synchronized contractions of the heart muscle that pump blood to all of the other parts in the body. Abnormalities can cause the heartbeat to slow or to go too fast if they're not following the normal conduction pathway. Sometimes people who have impairments in their electrical system of their heart require pacemakers or defibrillators to help their heart beat correctly. So just like we get repairs done on our houses, we have to think of our heart the same way. If you have an issue with your electrical system of your heart, you will seek out an electrophysiologist. This is a specialized cardiologist who deals with the electrical system. They can perform minimally invasive heart procedures, such as something called an ablation, to eliminate the source of the arrhythmia or change in normal conduction of the heart. At Oak Valley Health, we offer a variety of diagnostic procedures to care for your heart. Your care team may order blood work, perhaps a chest x-ray, telemetry, which is essentially monitoring your heart. In the previous slide, I showed an example of what a telemetry waveform may look like. They may order an echocardiogram that looks at the structure of your heart and also looks at the valves of your heart. They may order a transesophageal echocardiogram, which is actually just a different view of an echocardiogram. They may offer something like a cardioversion. That's something we do in our facilities here at Oak Valley Health. Unfortunately, our facility does not provide angiograms or angioplasties. We refer out to South Lake or Centenary for this procedure. If you're admitted as a cardiology patient, you may be admitted to 3 Center, which is our inpatient cardiology program. Recently, Oak Valley Health implemented a new technology. This is our Philips telemetry system. On September 28th, we went live with this update, and at our Uxbridge Hospital on October 5th. The new system allows for constant monitoring at the patient level. It minimizes interruptions in data collection, and it shows real-time data at the bedside. Because the alarm system is different, the nurses are able to effectively assess their patients with not as many alarms disturbing their work. A great feature of the new system is the ability for staff to visualize the prior data that was collected in the emergency department. And the new format allows strips to be captured electronically, which enhances the utilization of our Meditech and electronic documentation, so it decreases paper charting. On this slide, you'll see a telemetry strip as well as the telemetry monitoring. This is called our MX40, and this is what's currently used at Oak Valley Health. So if you were admitted to our 3 Center cardiology unit, you may see a cardiologist. You may also be under the care of an internal medicine physician, a nurse practitioner who specializes in cardiology. We work as a collaborative team with RNs, RPNs, and PSWs, which is the patient care assistant. You may be cared for by a dietitian, a speech and language pathologist, a physiotherapy team, and occupational therapy. So I know this is a lot of information, but let's get to the important stuff. What can I do to improve my heart health? The most important thing is having regular visits with your family doctor. Even if they're virtual, they're essential. It's important to have a family doctor. So if you don't have a family doctor, please access this link. It's important that we're able to support you in getting the care that you need. Just as specific parts of the house require checkups like a plumber an electrician or an architect, different heart diseases require different specialties. So it's really important that we start at square one and make sure that you do have a family physician so they can refer you out to the care providers that you need. That way they can do a comprehensive assessment of your heart. It's really important that you take medications as prescribed. If you have questions or you want to change your dose, please speak with a pharmacist before making these changes. Follow the instructions from your healthcare team on how to stay healthy. It's important that you check your blood pressure. So blood pressure measures the pressure of blood on the walls of your arteries. High blood pressure, also known as hypertension, is when your heart muscle has to work harder than normal to pump blood through your arteries. Eventually, this can weaken your artery walls and put you at increased risk of heart disease. Your blood pressure target depends on your age and whether or not you have diabetes. This is why it's so important to talk to your healthcare provider and make sure that you're tailoring your blood pressure to your unique scenario. So again, you can see on this slide, these risk categories again are from the heart and stroke. The textbook perfect blood pressure is 120/80, but that's not perfect for everyone. So please find out from your care providers what's perfect for you. Anytime your body is continuously having to work hard, it's going to have an impact on your overall health. Having monitoring of your blood pressure will make sure that you're on the right medications and you're getting the right follow-up you need. To the left of this slide, we talk about the difference between the systolic and the diastolic value. So the top number of your blood pressure is the amount of pressure against the walls of the artery when your heart pumps through your body, whereas the diastolic is the amount of pressure in your arteries when the heart refills and relaxes between heartbeats. It's important to have a healthy diet. Many cardiologists believe in the DASH diet. DASH stands for the Dietary Approaches to Stop Hypertension. So it's a healthy eating plan designed to help treat or prevent high blood pressure. This includes foods that are rich in potassium, calcium, and magnesium. These nutrients can help control blood pressure. It's also important that we reduce our risk of heart disease by reducing the alcohol consumption we have. You'll see on this slide, we talk about sodium levels. We want to limit our sodium levels to 2,300 milligrams per day, which is roughly the amount that's in 1 teaspoon of table salt. Again, it's important to get those nutrients. So talk about incorporating vegetables and fruit and whole grains into your diet, incorporating fat-free or low-free dairy products, fish, poultry, beans, and nuts. It's important to limit your foods high in saturated fats, such as full-fat dairy and full-fat meats. We need to consume food that's rich in potassium, calcium, magnesium, fiber, and protein. If you do have heart failure, you may have to limit the amount of fluids that you take in a day and make sure that you take that seriously and do monitor your fluid intake. Now let's put the information we learned together. So to improve your heart health, it's important to focus on these topics. Quit smoking. It's the most important thing you can do for your heart. Know your target blood pressure. Speak to your family physician and know where your blood pressure should be. Follow a healthy diet. Reduce your salt intake. Keep a healthy body weight. If you'd like to know more about waist circumference, please see the heart and stroke information provided at the end of this presentation. Be physically active. Try and get 30 minutes of physical activity in every day. And manage your stress. Here at Oak Valley Health, we offer a lot of mental health support, and I encourage you to seek those out if you're feeling like you're not coping with your current stress level. Thank you for attending today. Now I'll open it up for questions. Please put your questions in the chat box. Lynn, my colleague and co-host for today's session, will be helping me answer any questions that are brought up. Thanks again for attending.
Thank you, Angie. In that chat group, I can also add some links that were mentioned in the presentation. One of them will be through for the Heart and Stroke Foundation.
Great. Does anyone have any questions today about heart disease or heart health that I can help support?
So Angie, the first question you have is, what kind of exercise is best for your heart?
Great, that's a good question. So the best kind of exercise for you will depend on your exercise level to begin with. So it's important that you listen to your body and you don't overexert yourself. So starting out with 30 minutes of daily walking and then building up from that. It's important to see what your tolerance and your activity levels can achieve. So building on your exercise and not just starting out working out very hard, because that can be really challenging on your heart as well. Thank you for the question. I see something in the Q&A box. I'll just read that one out loud. If someone is at high risk for heart disease, should they carry aspirin with them at all times? That's a great question. Thank you for bringing that up. This is a great opportunity to speak with your family doctor. If you do not have any other contraindications for carrying aspirin all of the time, this would be a good strategy. But again, make this decision with your family physician, just to make sure that all of the other medications that you're on wouldn't be impacted by you taking aspirin. We'll just wait a couple more minutes to see if any more questions come in from the chat, but I really appreciate everyone taking the time out today to learn about heart health, and I hope you got something from the presentation and learned something new. We have lots of links on our Markham Stouffville webpage as well. So I urge you to look at those, but also check out the Heart and Stroke, because they have a plethora of resources that are very user-friendly.
And I think another good point, Angie, that if we were bringing up family physicians, I'll also add the link for your family doctor if someone was looking for a family physician in our chat group.
Thank you so much, Lynn. Yeah. Great, yeah. That's a great starting point. And getting to know what your family health history is another one. So understanding who in your family has had heart disease and being able to bring that information to your family physician appointment.
Okay. Great.
Great.
Great presentation.
Okay, I think that's it for today. Thank you so much. Okay, thank you so much
Angie.
for attending today.
Bye. Bye.